Next, we have up Dr. Daniel Grace. He's an associate professor at the Dalai Lama School of Public Health at the University of Toronto. Daniel is a sociologist who conducts research related to the sociology of knowledge, the social determinants of health, HIV, and the sexual health of gay men. Daniel conducted his postdoctoral research at the University of British Columbia and the London School of Hygiene and Tropical Medicine. His recent first-authored journal publications have appeared in Qualitative Health Research, AIDS Education and Prevention, Critical Public Health and Culture, Health and Sexuality. Welcome, Dr. Daniel Grace.
I'm just a lowly assistant professor. I don't know how I got a promotion, but that's my clarification. So it's a real pleasure to be here and to have the opportunity to present on behalf of the CIHR team in the study of acute HIV infection in gay men. I'll be presenting today on a paper we recently published in the journal AIDS Education and Prevention. So a lot of research on the sex lives of gay men has focused on charting behavioral trends quantitatively and emphasizing the different risk reduction strategies men use or do not use to reduce onward transmission after an HIV diagnosis. To critically extend this literature, we explore gay men's sex life narratives following their diagnosis with an acute or recent HIV infection. And I think this kind of contemporary empirical case study will really dovetail nicely with the historical context we've just been given. So I'll start by providing a brief background to our study and note some contextual information. I'll then describe our study methods, noting some of the kind of key qualitative components to our study design. For reasons of time, I'm really going to be focusing on this emergent discourse of undetectability that emerged in our data, and conclude with some discussion and final comments. So the context for our study is understanding narrative accounts in the context of treatment as prevention in Vancouver. We were really kind of interested in thinking how beyond academic and policy circles, how this kind of language of undetectability has been increasingly mainstreamed within broader public discourses, including within some communities of gay men. Now, researchers have questioned the extent to which discourses of undetectability are actually taken up by gay men in their everyday social and sexual lives. Some noting that a lack of clarity exists in the empirical data about how gay men diagnosed with HIV have incorporated knowledge of undetectability into perceptions of and responses to risk when engaging in condomless anal sex. So the objective of this analysis, like a lot of data, was kind of to catch up to what I think the community already knew, that a lot of this is going on, and people are engaging in discussions of undetectability. And so we're really kind of seeking to look at the multiple evolving factors that gay men recently diagnosed with HIV describe as informing their sexual behaviors over time. And I'll note that most of the images I'm drawing on here are from varied sexual health campaigns developed by our community partner, Health Initiative for Men. So this research that I'm reporting on occurred in the context of a large CIHR study around acute infection, a large mixed method study. For more information about acute infection and our other kind of study outputs, please see the work of our community partner, Health Initiative for Men, as well as our study website, acutehivstudy.com. So Health Initiative for Men has worked to disseminate information on acute infection, including various ads, posters, online advertisements with this kind of hottest at the start moniker. And this is just a sample of some of the social marketing campaign materials that were developed. So our study began in 2009 and completed enrollment of new participants in 2012. This is just kind of a snapshot of our different mixed method study activities. We had a great session yesterday that Travis led on kind of mixed methods and what kind of turns you on in research. And I'd say one thing that really turns me on is theoretically driven longitudinal qualitative research. So yeah, that's like on my profile. So this is what I'm focusing on here, this bottom 4 in-depth qualitative interviews that took place with guys over a year. And Murray et al. Notes that one of the values of repeated interviewing is it gives, quote, participants implicit permission to broach what was previously unspeakable, facilitating frank and honest discussions that might otherwise not have occurred. Detailed and contextualized accounts of sensitive illness experiences can therefore emerge. And so the real focus here is really accounting for questions of temporality and change as a central feature of this kind of research. And it's really predicated on this kind of investigation of interpretation and change over time. So these are the kind of key domains that we covered in the interview. And so during the course of interviews, we probed further to explore emerging information regarding the lived experience of participants. Interview guides were developed iteratively with study investigators and in consultation with the community. These first 2 domains, diagnosis, experience, and infection, possible infection event, were kind of took place in the first baseline interview, and these other domains emerged in the 2nd, 3rd, and 4th interview. So we recruited 25 men after receiving an acute or recent diagnosis at one of 6 clinic sites in Vancouver. As you saw on that last slide, participants completed self-administered quantitative questionnaires and concurrent qualitative in-depth interviews at 4 time points over the year. And this was the first kind of wave of study participants receiving an acute diagnosis via nucleic acid amplification technology. And so there was an important kind of learning curve to this first wave of diagnoses, which led to modifications in testing and diagnosis protocols. So from a kind of theory, methods, nerdy perspective, this was a kind of exciting opportunity to explore and analyze the data both as kind of single cases, so how individuals experience over 4 interviews and what changed and what didn't and milestones, as well as looking across the whole data set. So the majority of our participants lived in Vancouver at the time of the study enrollment, identified as gay, were single, 30, and white, 12% identified as Southeast Asian, and 8% Hispanic. Most participants completed university and were employed full-time with considerable diversity among those who were not. Participants described using a diverse use of substances with sex, the most common being alcohol, cocaine, crystal meth, and ecstasy. Some men also said, since receiving their diagnosis, that they weren't interested in sex, 32%, or had difficulty getting aroused. At baseline, 60% of men said that they weren't currently satisfied with their sex lives. So I'm going to now present results on our analysis of this kind of longitudinal qualitative work. And participants really discussed changes in their sex lives following diagnosis, many of which they attributed to living with HIV. And men talked about how their approaches to sex evolved over time and in subsequent follow-ups. With few exceptions, participants described refraining from sex in the period immediately following their diagnosis and later resumed having sex. Over the course of longitudinal interviews, men discussed overlapping domains related to their sex lives. A key issue men frequently spoke about was this kind of emergent idea of undetectability. We didn't set out to explore this. This wasn't foregrounded as a key question or probe, but was kind of emerged iteratively through the process of data collection and subsequent analysis. And so our analysis follows the work of Davis, among others, in that we understand our participants to be social actors actively engaged in the construction of risk management and self-identity using the knowledge resources at their disposal. Thus, narratives about risk, health technologies, and sexual practices can be interpreted as instances of risk knowledge reproduction and provide insight into the individual in relationship with aspects of HIV treatment technologies. So we would extend this to argue that analysis of gay men's sex life narratives with a focus on discourses of undetectability sheds light on complex negotiations of risk management and has implications for HIV and STI transmission. So the majority of our participants discussed how changing HIV viral loads over time impacted their sexual decision-making following their diagnosis with an acute or recent infection. For many men, particularly those who were diagnosed in the acute phase, discussions of viral loads started at diagnosis. These men reported that healthcare providers explained the heightened possibility of onward transmission during the initial phase of acute infection. Participants reported that learning of their viral load had an important influence on decisions to return to sexual activity. So, for example, some men explained that they chose not to resume sex until their viral load was undetectable. So here we see a quote from Dennis, who explained not wanting to engage in sexual play until he knew he was undetectable as a result of medication. Quote, personally, I didn't feel comfortable, so I didn't play until I was undetectable. Men who said that they resumed sexual activity prior to having an undetectable viral load described taking a number of steps to ensure both their comfort and a consideration of their partner's health. Some participants were really clear to distinguish between starting treatment as a sole prevention strategy and starting treatment as part of a prevention strategy. So Thomas talked about having a low viral load being part of his overall HIV risk management strategy, viewing undetectability as something that suppresses the risk even further. For Thomas, quote, being less careful here meant having condomless sex with HIV negative or HIV positive partners. So one thing that really emerged across the interviews was that being told of their undetectable status was really described as a significant milestone for a lot of our participants. Men said that kind of, quote, achieving or, quote, getting to this suppressed viral load made them more comfortable when having sex and disclosing their HIV status to sexual partners, as well as increasing their sexual freedom and decreasing concerns about onward transmission. So Joel explained the multiple sexual, emotional, and psychological benefits to his continued use of HIV treatment. Quote, once the doctor says that you're undetectable and you are like well on your way, and when you find out that you are this healthy, I mean, how do you go wrong? Where do you go wrong with that? Do you know what I mean? You feel like, okay, I can live again. I can go date guys. So mentally and emotionally, in so many different ways, it relieves that block, knowing, okay, I can tell you I'm HIV positive, but I'm undetectable, which means it's a lot harder to get it from me. Participants reported additional impacts resulting from the knowledge of their undetectable status beyond solely those related to sexual activity. So for example, Stephen said that having an undetectable viral load was the milestone of, number one, accepting that I actually have this condition, and number two, taking proactive steps to manage it. In a very vague sort of way, you could kind of sort of say that being undetectable means that I'm normal again. However, some participants reported continued sexual caution regarding how to interpret being told that they now, quote, can't pass it, HIV, on when having condomless sex. For example, Keith described, no, the whole me not blowing my load into someone, I think that's a mental block. I don't know why. Like, I know being undetectable. Again, they're telling me that I can't pass it on. So Keith was describing a kind of ongoing mental block he has with the kind of biomedical information he was given regarding the full implications of what this information, quote, should tell him regarding the safety of condomless anal sex. Men also discussed that having an undetectable viral load is used as its own category of HIV status among some gay men, both in person and online. For example, Victor said that when hooking up online, quote, most guys, they put undetectable, actually, instead of their positive. Victor went on to explain that his choices of sexual partners are informed to some extent by their HIV status, and if HIV positive, their treatment and adherence status. Connecting to Victor's narrative, Paul, who was not on medication at the time of his second interview, described encountering rejection from prospective sexual partners online, not because of his HIV status, but because he was not undetectable. Paul recounted how discussions of HIV treatment and undetectability kind of enter these online spaces. Quote, and some HIV negative gay men are fine with positive and they say, you know, are you undetectable? And I say no, and oh, well, when do you start treatment? Well, I haven't, and that's it. And sometimes that just shuts down. Both Victor and Paul's evolving narratives raise the issue of stigma, HIV reinfection or superinfection, and the sexual possibilities that invoking an undetectable identity may afford. So some men also identified the need for more clear information to be provided to HIV-positive individuals to support them in negotiating the possibility of onward transmission and maintaining their own health. And Paul kind of echoed this need for more information in his subsequent interview. Our research suggests that men's understandings of their undetectable status should be interpreted and factored into risk reduction strategies, and it's variable and should be a stronger focus of health promotion, counseling, and sexual health literacy interventions. Men's engagements with the meaning of reaching the, quote, milestone of becoming undetectable are occurring within what Adam calls an era of biomedical normalization and, quote, widespread awareness of the facts of transmission. And while I think Adam's point is really well taken here, despite the widespread knowledge of our participants that a suppressed viral load reduces the risk of transmission, for some, the biomedical, quote, facts associated with undetectability remain somewhat unclear. For our participants, it's clear that knowledge of their undetectable HIV status was incorporated into their identities as HIV-positive gay men and their sexual decision-making processes, albeit in complex ways, including, but not limited to, informing what Race has described as, quote, prevention identities. Drawing on related scholarship, it's important to note that for some men in our sample, early decisions about treatment initiation were informed by a desire to, quote, bring down high viral loads. As Flowers has explained, health information, including the meaning of viral load and concepts such as undetectability levels and the relationship of these factors to understandings of infectivity, have entered the social world of gay men and shifted the parameters of risk management once more. We recognize the significance of having an undetectable viral load was interpreted differently by participants over time, and the sources of this knowledge may be multiple, including information obtained from friends, health professionals, peer counselors, online sources, and outlets within and outside of the gay community. And these differential interpretations of undetectability may be informed with other discussions of biomedical strategies, some of which we've been talking about at the summit, including current discussions of PrEP. So our analysis is subject to a number of limitations. So if you're interested in the kind of more thorough methods, nerdy limitations, you can see the publication or talk to me. And obviously there's a lot, and this is just a small sample that's Vancouver-based, but we think that it's provided us entry into a really interesting and important process that's going on in the gay community. And of course, it's worth underscoring that we don't have access to gay men's sexual experiences and decision-making processes post-diagnosis beyond these kind of detailed longitudinal counts. So the participants in our sample are embedded within and serve to co-produce the discourse of undetectability, with varying, sometimes competing claims and understandings about the implications of an undetectable status upon HIV transmission risks and the durability of this category. In closing, we'd argue that our participant narratives make visible the emergence of prevention identity, which have really important connections to discourses and understandings of treatment as prevention. However, men's accounts of their sex lives after diagnosis also reveal some of the ways in which this discourse of undetectability is actively co-constituted and reproduced as it plays out in gay guys' everyday social and sexual lives, serving as an aspiration or goal to achieve, as a facilitator of HIV status disclosure, as a signifier of a return to normalcy post-diagnosis, as a category enabling sexual possibilities and rejections, as a source of emotional and mental comfort, and for some, as a source of discomfort, confusion, and contention requiring further public health guidance. If you haven't seen Katie's latest information on this, I'd encourage you to visit their website and see their most recent information. And I thought I would just end with some recent campaign materials I've seen that have incorporated undetectability within their materials. I thought these were kind of interesting and provoking. I don't know if people have seen The Undetectables, which is a comic book series. They're kind of, out there fighting. It's a US-based Housing Works program. And another recent program out of Australia. This is Dorothy. They have a whole campaign called the Wizards of Pause, and I like this kind of description here of Dorothy. In Wizards of Pause, our Dorothy is a wide-eyed hipster dream in Gangnam cutoffs, just starting his journey to, quote, follow the undetectable viral load. So I think we're really in our qualitative work just catching up to what's going on in the community and hopefully engaging and giving some kind of nuanced contextual information about the significance of undetectability. Thanks very much. And I'd just like to close by thanking all of our community partners, CIHR, the Health Initiative for Men, and a special thank you to all my co-authors on the paper, Mark Gilbert, Malcolm Steinberg, Michael Quagg, Sarah Chown, and Elgin Lim. Thanks very much.